Hello and welcome. Today we're diving deep into a neurological condition known as autoimmune large fiber neuropathy, or ALFN. This is a disorder where the body's own immune system mistakenly attacks and damages the large nerve fibers, leading to a range of challenging symptoms. Join us as we explore its causes, effects, and how it's managed. So, what exactly causes autoimmune large fiber neuropathy? In short, it's an autoimmune disease. This means the body's immune system, which is normally designed to fight off infections and foreign invaders, misidentifies the large nerve fibers as threats. It then launches an attack, leading to inflammation and damage. While the precise trigger for this autoimmune response often remains unknown, it's sometimes associated with underlying conditions like infections, autoimmune disorders such as lupus or Sjogren's syndrome, or even certain cancers. In some cases, it may occur without any identifiable underlying cause termed idiopathic. To understand ALFN, we need to understand what it does to the nerves. Large nerve fibers are essential for transmitting sensory information about touch, vibration, and position sense, also known as proprioception, from the body to the brain. They also carry motor signals from the brain to the muscles, enabling movement. In ALFN, the immune attack damages the myelin sheath, which is the protective insulation around these nerve fibers. This damage disrupts the nerve signals, causing them to be transmitted more slowly or not at all. This disruption leads to the characteristic symptoms of the disease. Autoimmune large fiber neuropathy is considered a rare condition. Precise epidemiological data is limited, making it difficult to pinpoint the exact prevalence and incidence rates. This rarity often leads to delayed diagnosis, as healthcare professionals may not immediately consider ALFF in the initial evaluation of patients presenting with relevant symptoms. It can affect individuals of all ages, but it's more commonly diagnosed in adults. Further research is needed to gain a clearer understanding of its true prevalence and distribution across different populations. The symptoms of ALFN can be quite varied and impactful. Because large nerve fibers are responsible for transmitting touch, vibration, and position sense, patients often experience sensory problems. This can include numbness, tingling, or a burning sensation, typically starting in the feet and hands and gradually progressing upwards. They may also have difficulty with balance and coordination due to impaired proprioception. In some cases, ALF can also affect motor function, leading to weakness, particularly in the legs. These symptoms can significantly interfere with daily activities and quality of life. Diagnosing autoimmune large fiber neuropathy can be challenging and typically involves a combination of clinical evaluation, nerve conduction studies, and laboratory tests. A thorough medical history and physical examination are essential. Nerve conduction studies are used to assess the function of the large nerve fibers. These studies measure how quickly and effectively electrical signals travel through the nerves. In ALFN, the nerve conduction velocities may be slowed or absent in the affected nerves. Laboratory tests are also performed to look for evidence of an autoimmune process. This may include testing for specific antibodies known to target nerve tissue or markers of inflammation. In some cases, a nerve biopsy may be necessary to confirm the diagnosis and rule out other possible causes of neuropathy. While autoimmune large fiber neuropathy doesn't have definitive subtypes, it can present with varying degrees of sensory and motor involvement, as well as different patterns of progression. Some individuals primarily experience sensory symptoms, while others have more pronounced motor deficits. The rate at which the disease progresses can also vary from person to person. Recognizing these variations is important for tailoring treatment and management strategies to the individual needs of each patient. The primary goal of treatment for ALFN is to suppress the immune system and reduce the inflammation that is damaging the nerves. Immunosuppressive medications, such as corticosteroids like prednisone, intravenous immunoglobulin V, and plasma exchange, are commonly used. EVAG involves infusing healthy antibodies into the bloodstream to help modulate the immune response. Plasma exchange removes harmful antibodies from the blood. These treatments aim to halt the progression of the disease and improve symptoms. In addition to immunosuppression, symptomatic management is also important. Physical therapy can help improve strength, balance, and coordination. Pain medications may be prescribed to alleviate pain and discomfort. Assistive devices, such as braces or walkers, can help improve mobility and independence. Unfortunately, there's no known way to definitively prevent autoimmune large fiber neuropathy, given that the underlying causes often remain unclear. However, maintaining a healthy lifestyle, including a balanced diet, regular exercise, and avoiding known triggers for autoimmune reactions, may potentially help reduce the risk. Early diagnosis and treatment of any underlying conditions associated with ALFN, such as infections or autoimmune disorders, may also be beneficial. The prognosis for autoimmune large fiber neuropathy varies depending on the individual and the severity of the disease. Some individuals may experience significant improvement with treatment, while others may have persistent symptoms and disability. Early diagnosis and treatment are important to maximize the chances of a favorable outcome. Research continues to advance our understanding of ALFN and develop new treatment strategies. Recent studies have focused on identifying specific autoantibodies that target nerve tissue, which could lead to more targeted therapies. Clinical trials are also underway to evaluate the effectiveness of novel immunosuppressive agents and regenerative therapies for nerve repair. These advances offer hope for improved outcomes and a better quality of life for individuals living with ALFN.